Hello, everyone. My name is Javad Parvizi. I'm a professor of orthopedic surgery at Acıbadem University in Istanbul. I had the pleasure of being one of the delegates at the International Consensus Meeting 2025 that was held in Istanbul in May of this year. I have the most distinct pleasure of introducing you to one of my friends and colleagues who has been working with me for many years, Professor Javad Mortazavi. Yes, the same first name. That's my honor. And he is currently at the University of Tehran. He deals with very complex problems, hip and knee reconstruction. He also takes care of very challenging cases of periprosthetic joint infection. He was the lead author and the liaison for one of the questions that was discussed during the International Consensus Meeting. The question was, does preoperative anemia predispose patients to surgical site infections, periprosthetic joint infection, after orthopedic procedures? Dr. Mortazavi, what do you think?
Uh, Hi, everyone. Thank you very much for the nice introduction. And this is my pleasure to be part of the ICM 2025 and also working at liaison for this question. As you know, anemia is a common problem in many surgical patients, and it is often overlooked. So, if it turns out that anemia is a risk factor for infection, it is very important because it could be potentially a modifiable risk factor. We can treat patient in advance before the surgery so we can decrease the risk of infection in those patients. So this is the main point about this topic. It is a modifier risk factor, and if we can show it is a risk factor, we can treat it in advance.
Fantastic. You done an amazing job, and obviously the document will be published in Journal of Arthroplasty for people to read the extensive work that went into it. And over 90%, 91.4% agreed that anemia is a risk factor for SSI and PJI. And as you very nicely highlighted, it's a modifiable risk factor for most people, if not everyone. So why is anemia a risk factor for SSI?
I think there are many potential mechanisms for anemia to be a risk factor. First of all, anemia decrease oxygen carrying capacity of the blood. So we have less oxygen delivered to the healing tissue, and therefore the healing and repair of wound slows down by anemia. In addition, some studies showed that anemia weakened the immune system, especially iron deficiency anemia. So this is the second reason that anemia could increase the infection risk. Furthermore, patients with anemia are at increased risk of transfusion. And we know that transfusion have several complications, including increase the risk of infection. And finally, anemia is a sign in a patient. Those patients could have other health issues. So anemia is a signal. And other health issues in the patient with anemia also could increase the risk of infection. So there is four potential mechanisms for which the anemia can increase the risk of infection after different orthopedic procedures.
Fantastic. That's very comprehensive. So I have a patient who's undergoing an orthopedic procedure. During preoperative screening, hemoglobin comes back as 9. What do I do?
I mean, the first thing is the 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 this issue should solve with our operative team. We need to work up for the reason of anemia before the surgery. What is the reason for this anemia? This is an iron deficiency anemia or other type of anemia. And if we find out the reason, we should try to treat this anemia in advance before the surgery to hemoglobin comes up, and then do an elective procedure like joint arthroplasty.
Okay, perfect. So you would get your internist and maybe a hematologist, evaluate them. Is it microcytic? Is it macrocytic? Is it this, that? There's different types. Some of them are addressable, some are not. If they are disease, if they are anemia of the chronic disease, do you think erythropoietin has a role in trying to address anemia prior to surgery?
I don't think erythropoietin is effective for those patients with anemia of chronic disease.
Mhm.
And I think those patients with chronic disease and anemia related to chronic disease actually could, could tolerate the surgery, and we can go ahead with the surgery before treat those patients with erythropoietin or other issues. The mechanism by which those patients have anemia is very important, and most of the time we could not treat them with with interventions like erythropoietin therapy.
Okay, but to your point, they need to be evaluated. Cause of anemia needs to be determined, and the therapeutic intervention will be determined by the preoperative team. Finally, I know that tranexamic acid is a question for another day. We will go through it. But is it fair to say that you use tranexamic acid in just about every patient that you operate on? And particularly, that's a very important intervention for patients with anemia?
Yes. I use tranexamic in every patient, especially those patients with anemia, because it significantly decreased the blood loss during the surgery and also after the surgery. So total, we have less blood loss, and then it is very important in patient with anemia, as you mentioned.
Well, there you have it, folks. Professor Mortazavi has spoken. His and his team did finish that question. As I mentioned, 91% of delegates attending the ICMI agreed that anemia is a risk factor for SSI PJI. He's just proposed to us what to do with the anemic patients. He's a high volume orthopedic surgeon in Iran. I'm sure he sees a lot of patients with anemia, and he's the right person to talk to us about this issue. Professor Mortazavi, before I let you go, do you have any last minute advice, any last minute words for our audience?
The final point that I'm going to tell to audience is the fact that anemia is important. It is often overlooked. It is often treatable, so it is a modifier risk factor. And if we treat anemia before the surgery on those patients that is treatable, we can improve the patient outcome for those orthopedic procedure that we are done for the patients.
With those final words of wisdom, this podcast comes to an end. Thank you very much.